Okay, perfect.
All right, so we are officially live on Facebook. I'm going to come back now. Yay. All right, so it is 12:04. We'll give it another second and we'll go. We're officially live on Facebook. Like I said, we're live here. Everything's tested. A number of people are still coming in. So we will go ahead and get started. I am Kendra Nielsen-Miles. I'm the Executive Director and Founder of EDS Wellness. Welcome to everybody who's joining us again. We've had a number of webinars consistently back to back every week, so this has been great, but we have so many wonderful people that are willing to devote their time and volunteer and share with us. So we have Brianna Cardenas here. She's a physician assistant. She's also an EDS community member, and she is a wonderful wealth of resources talking about cerebral spinal fluid leaks. This is also part of our 2019 webinar series. I have been waiting to work with Brianna for quite a while, actually. We first talked to each other, I think, on LinkedIn. It was a couple of years ago. And then we were just kind of waiting. I finally reached out to her recently and said, okay, let's do it. We want to do it. And it was just so happened to be perfect because it's CSF leak, right? Leak week.
It's Leak Week, yeah.
Right, so she's going to be sharing a lot more with us. We are live on the EDS Wellness Facebook page. If you want to share that stream wherever, that would be great, but just please make sure that any questions or comments that you have that you want us to see or interact with, that you either do it through Zoom in the chat or that you do it underneath the stream on the Facebook live feed. Or else when it's shared elsewhere, we won't see those comments underneath the feed elsewhere. We're gonna focus on EDS Wellness's page, the feed there, and then also through Zoom. So we're gonna go ahead and get started now, and I'm gonna let Brianna do a better introduction of herself, her experience, her new professional roles that she's taken on, which are pretty exciting, especially for us, and to continue educating the medical community, which is just awesome. You can also just go ahead and pull up your screen if you want to, or you can do an introduction first and then pull up your screen if you want to.
I'll pull up the screen, no problem. So let me see.
Yeah, and I'm going to quiet my mic and my video so that you can go ahead and get started, and then we'll come back on. We'll try to save the Q&A until after.
Okay.
There's the Facebook feed. Awesome.
All right. So this is my website. That works to show my website, I guess. For
yeah.
Myself. My name is Brianna Cardenas. I am a physician assistant, a certified athletic trainer, and now I am a physician assistant professor at the University of Laverne in Southern California. My background as a PA was in pain management. So I have at this time, if you combine my athletic training and my PA experience, almost a decade of pain management experience. I'm also a EDS patient, and I am still on the road to recovery, but I'm much further along on this road than I was this time last year from my experience with a spinal CSF leak. And this was a really mysterious and disabling condition that not a lot of my healthcare providers knew about. I didn't even know about it until it affected me. So I'm really excited to share all about it. And I have recently started a business called Healed and Empowered, where I help people with chronic illness reach pain management resources and get back to hopefully a better quality of life, and educate them and offer resources about spinal CSF leaks, about EDS. And I now see patients pretty much exclusively with HSD or EDS. So it's really, really exciting. That's how I still work in a clinic role. And now I teach physician assistant students. So at least 22 new students a year in Southern California, when they go out into profession, will know what EDS is. They'll know what a CSF leak is. They'll know what CCI and dysautonomia all look like, and we'll hopefully start to see a shift in the care that people receive with these conditions. So I'm really excited for that. And to get started, I'm going to show a brief 2-minute video. As Kendra pointed out, it is Leak Week from the Spinal CSF Leak Foundation. They're a great organization dedicated to really helping patients with this condition to really start to understand and hopefully bridge some treatment gaps. So I'm going to share this video because I think that it summarizes everything really beautifully in a nice, easy to understand 2-minute video. So here we go.
Brianna,
Yes.
we can't hear the video, so I don't know if you want to comment on it as it's playing.
Okay. Sorry. I didn't
Yeah,
know.
no, that's okay. I mean, it's actually great. It's great. It's great graphics, so we can actually, I think a lot of us can make it out.
Okay.
But yeah, so maybe so maybe you can kind of just comment on what it is and what
Sure.
you're saying.
Yeah.
Great video.
Okay, so that's Anna. She never had headaches before, but suddenly she started developing them. She started developing a CSF leak, or a cerebral spinal fluid leak. And so this layer on the outside called the dura is a tough layer made of connective tissue that's normally supposed to hold the fluid in. But as it leaks out, you can see the brain starts to drop and the fluid is lost if there's a hole in that membrane. So EDSers are really prone to that because it's made of the same stuff that ligaments are made of. So when there's enough fluid, everything's fine. But as she loses spinal fluid, or as we lose spinal fluid, it causes a myriad of symptoms: positional headache, nausea, brain fog, dizziness, all of these things. I'm going to pause that for just a second so people can go back and see that. So all of these symptoms right here are, really mimics of a lot of other conditions that EDSers have. But it's really important to know that CSF leaks are not just headaches. A lot of neurologists still say, oh, it's just a headache. It's not a big deal. But you can see some of the symptoms or side effects and results of a CSF leak can include a stroke, a coma, or even death. And the reason for that is because the brain actually sinks down in the skull as a result of loss of fluid. Symptoms are significantly worse when patients are upright due to the loss of that fluid. And so Anna here is in bed because really the only way you can get comfortable or have alleviation of symptoms is if you're flat and your head is even with the rest of your body. So she talked about how she went and saw lots of doctors, medicines didn't work, lots of different tests were done, and finally a special test was done on her spine to find that she had a leak in her spinal fluid. So they did a procedure called an epidural blood patch. They sealed the membrane back up, and her headaches resolved. So if you have an upright headache, and it's more severe when you're upright and it gets worse throughout the day, it says talk to your doctor because it could be a spinal CSF leak. And please share this video. It's on spinalcsfleak.org, or if you just search upright headache, it's going to be on there as well. So sorry for the volume issue there. But the Spinal CSF Leak Foundation is awesome. I highly recommend them because there's a lot of support and a lot of information there. This is what their website looks like, and their videos right there on that front page. So fun stuff that's going on this week. It is Leak Week. So this is our week where we really strive to raise as much awareness as possible from June 3rd to 8th. We have an Instagram, Facebook, all that good stuff. So if you would like to get support and learn more, the Spinal CSF Leak Foundation is a great option. But I'm going to go ahead and pull up my PowerPoint. Can you guys see that, Kendra? And can you hear me okay?
We're all good.
Awesome.
Everything's great. And your explanation of the video was awesome. And I appreciate that you shared the resources on csf.org because that is an important, I didn't even know that they existed. And I think I actually just recently talked to Dr. Francomano about them, from my own, I always share my own personal issues, from my own trying to figure out if this is something that I've been dealing with personally, and whether or not I should be really paying attention to it. So it's an organization that I didn't really understand and knew what was out there and what was on their website. So I really appreciate you sharing not only the video and commenting on it, but also just giving some information and showing people where to find stuff on that. So that was great. So thank you.
Thanks, no problem. Well, my little lights in my office just went out. I have like little sensors in here.
We can still see you.
Okay, perfect. I was gonna say I can just stand up really quick and make sure. It looks like my face is like super blurred out. There we go. Is that a little bit better?
Yeah, that's good. That's good.
Perfect. All right. So spinal CSF leaks create a condition called intracranial hypotension. So intracranial meaning inside the head, and hypotension meaning not enough pressure. So some people are probably really familiar with like POTS, and that's postural orthostatic tachycardia syndrome, or orthostatic intolerance, or hypotension, like as it pertains to your blood volume. But hypotension can occur anywhere, and it can occur including the spinal fluid inside of our head. So the terms spinal CSF leak and intracranial hypotension are potentially used interchangeably from a medical standpoint. So if you hear someone talking about intracranial hypotension, really the only cause of that we know of is a CSF leak somewhere. The further down in the spine it is, the more fluid is lost because it's just gravity, right? So if you have a hole up here, then you only lose this much fluid. But if you have a hole way down by your tailbone, you could potentially lose a lot of fluid. So depending on where the leak is will change symptom severity. And depending on how many leaks there are, the symptoms will change. So a little bit of background. Note my stock image here. I didn't want to pay for it, so it still has a watermark. But the blue fluid around the brain is meant to be a cushion for our brain and spinal cord. So the abbreviation for that fluid is called CSF. It's fluid that surrounds the brain, and the brain should be in a floating state. But when that volume is lost, we start to see a drop in the brain or a sag in that brain and spinal cord area. And then what happens is rather than our brain floating in that cerebrospinal fluid, our brain just sits on the base of our skull. So normally it should be base of our skull and our brain floats on it. But as you lose that fluid, the brain just sits on it. And the base of our brain has lots and lots of structures that are really important to important things like breathing and swallowing and our heart rate. So it can really cause some disabling symptoms if those structures are irritated. It's important to note that this condition is curable. It's completely treatable, and it's only in cases of prolonged misdiagnosis that we see significant disability, and it becomes harder to treat the longer that we wait. So disability is a huge result of this one. I literally was bedbound for months as a result of this, and had such cognitive disturbance at one time that I couldn't speak in full sentences. So it really had a significant impact. And it's our biggest issue right now is lack of awareness. So basically the fact that people don't even know about it, not even healthcare professionals, prolongs that time to diagnosis. So a lot of people will get diagnosis like migraine or a tension headache, or if you're a young woman, especially our EDS population is probably familiar with this, maybe it's anxiety. So you'll get a lot of misdiagnosis before the appropriate diagnosis is made. And it's important to note that there's 3 different types of CSF leaks. So the most common is called iatrogenic, meaning it's caused by a medical procedure. So most healthcare providers are familiar with this kind of spinal fluid leak. Hey, you had an epidural and now you have a headache. Oh, that makes sense. It's because we poked your dura and now there's a hole. So they're familiar with that. Or, oh, you had a high impact event or a whiplash or some type of like severe trauma to your back. Okay, that makes sense. That could tear that membrane. But spontaneous spinal fluid leaks, I have that way up at the top, are the most common in EDSers because since our dura, that membrane, is very weak, it can create little pockets where it kind of outpouches and then eventually tears. And it can just tear on its own weight. It can tear from some type of twist or turn. It can tear from straining or even just, pushing down or bearing down too hard, like with the bowel movement or with, any type of strenuous lifting. So with underlying connective tissue disorder like HSD, like Ehlers-Danlos syndrome, like Marfan syndrome, and other connective tissue disorders, that can cause that membrane to tear. Other things like a calcified disc or arthritis that creates bone spurring in the spine, that can cause a sharp object essentially in our spine that can tear that membrane. So these things can happen just spontaneously, but a lot of healthcare providers are not familiar with this kind, and this is super duper under recognized. So we're now, we're confirmed that EDS is a risk factor for spontaneous spinal fluid leaks. Now this picture here is the base of the base of the brain, and all of the yellow structures right here. So this is like our brain as we think of it, cerebrum at the top. Can you see my mouse, Kendra? A little cursor.
Yes, I can see your mouse.
Okay, perfect. So up here is like the base of the brain. Our eyes are up here at the top. The back of our head is down here. And note that the spinal cord is here and the base of our brain, or the cerebellum, is right here. That's like what controls our movement, centers, and so forth. And these yellow things are our cranial nerves. And our cranial nerves control things like our eyes being able to move back and forth, our ability to blink, our ability to smell, our ability to swallow, our ability to recognize where our body is in space, so our proprioception. And it can cause, the vagus nerve is one of them, that's cranial nerve 10. And that one controls a lot of things. That controls our digestion, that controls our heart rate, that controls our response to stress, and even things like our pupil dilation and stuff. So there's a lot that the vagus nerve and the cranial nerves control, that basically these structures, when you lose that cushion of spinal fluid, so again, if your brain's supposed to be floating on your skull base and then it drops down, those nerves all get squished under there. And that really creates a problem, because these are vital functions. Another kind of barrier to the anatomy, or just the diagnosis of this, is the fact that the anatomy of this is pain insensitive in a lot of times. So our skull base, the brain matter itself, or the brain parenchyma, which is just like when you think of a brain, like the matter that it's made of, our pituitary glands, our arachnoid and pia mater, which are other linings of our brain, those don't have pain sensitive structures in them. So we don't know that something is wrong if those structures get irritated. The only pain sensitive structures are the nerves themselves, the lower dura, which is like kind of in our neck junction base, and our arteries that go through and feed our brain. And so it's not until those structures get compromised that we even are really aware that something is wrong. So that occurs later in the stages, because if you have a small CSF leak, then potentially these structures don't get compromised, but you don't feel good. You know something is wrong. You know there's some type of, something's wrong with your body. My first symptom, believe it or not, was just nausea. Like I woke up with nausea one day and was just nauseous for almost 4 years, and it just never went away. And it's because my pituitary gland was starting to get crushed. But because that structure is not sensitive to pain, I had no idea that there was something wrong with my pituitary. So it was really wild. Like I just woke up with nausea one day and it never went away. So some common signs and symptoms of CSF leaks. Brace yourself. This is a long list. And the more confusing part that makes this diagnosis even a little bit more difficult is the fact that these symptoms look a lot like other symptoms of other conditions that a lot of EDSers have. So the most common symptom is a positional headache, meaning you stand up and your head hurts. With a slow CSF leak, the longer you're upright, the worse it hurts. And with a slow leak, it might not be apparent at first. So you won't have like, oh, I lay down and then I stand up and all of a sudden a 10 out of 10 headache. You might have like, you wake up and, as the day goes on, you just feel more tired, like you need more coffee, or you just kind of crash at the end of the day. And then by the time the day is over, your neck hurts and you're exhausted and you're fatigued and you're just not feeling good, but you have a headache and you're just, maybe it's, the day was too long, or maybe this day just took it out of you. So if you have a headache at the second half of the day, that could be an indicator of a spinal fluid leak as well. Interscapular pain, meaning pain between your shoulder blades, not like muscle pain, but like in the nerves, like if it feels, like something is irritated in there. Changes in your balance, changes in your sensitivity to light or sound. Brain fog is the big one. So the brain fog was honestly one of the most disabling symptoms for me. And then for me, I had a lot of hearing changes as well. So I felt like I constantly had to like pop my ear or like kind of like open my jaw, like what's the problem here. And I constantly had crackles and pops in my ears. Like I, just had pop rocks in there or something. I couldn't put my finger on it. I also noticed that my arms started to go numb. So my left hand specifically was more numb than the other. And note that nausea and vomiting are another common symptom. So these are all the common symptoms. And a big note here is that a lot of these are subjective symptoms. So you have to hope that your healthcare provider is using their ears and listening to you and really, taking a good history. But if you're in there for 10 minutes and they already have decided that it's anxiety, or they've already decided that it's like a tension headache, like you're going to have a hard time being taken seriously if you haven't kept, track of all these symptoms and started putting them together yourself, really to advocate for yourself. And again, that big hallmark is you're less functional as the day goes on. Less common symptoms and rare complications are listed out here. Some people go so far as to have like visual changes, numbness in their face, changes in like how things taste. Some people report like a metallic taste in their mouth. Tachycardia is a less common symptom, but the more EDSers that we find with this condition, we're starting to see that tachycardia is a common symptom. So for me, the CSF leak gave me POTS and dysautonomia because my brainstem was compressed as a result of my brainstem sagging. So my clinical picture when I, was getting closer to diagnosis really looked like POTS. Because I would stand up, and as soon as I would stand up, my heart rate would go from like 60 to 120. I had a lot of the numbness. I had a lot of the like positional balance disturbances. I started to develop a lot of chemical sensitivities that started to look like MCAS because my dysautonomia, my brainstem just couldn't regulate it. I also started to develop some tremors and tics, which were really unusual. So my hand would literally just like twitch and tremor. And it was like a jerk, like a dystonic jerk. And those have all completely gone away now that I've had treatment of my spinal fluid, which is a huge deal because that means that this is potentially a cause of POTS and dysautonomia that is curable. Like literally you can do a procedure and it's gone, which is a huge, huge, huge deal. Granted, that doesn't encompass all cases of POTS. It doesn't encompass all cases of dysautonomia. But if this is a cause of it, it's treatable, which, I mean, who doesn't want to have treatment or a cure to these disabling symptoms? In really, really rare cases, people can die of this. Some people have had strokes as a cause of this because as you lose fluid in your brain, in order to try and compensate for the volume, the blood vessels start to stretch out and enlarge to try and occupy some of that space. So if you have EDS, and an enlarged blood vessel, then you're at risk for, that blood vessel to tear or to bleed, and that can cause a stroke. So there's definitely a lot of serious complications, but fortunately the serious complications that are like fatal are pretty rare. They've only been seen a couple of times, like in the literature. Interesting is that it says one of the complications of an undiagnosed CSF leak is dementia. Again, it's a treatable and curable condition when you have a spinal fluid leak. So this is what I'm going to be doing my research on at the University of Laverne. My goal is to find out what percentage of people with dementia actually have undiagnosed CSF leaks and what we can do to hopefully create awareness around this and treat people that have this condition. So it's going to be really, really interesting research that we do. Important notes, again, is that a lot of these look like other EDS-related headaches and syndromes. So this clinically looks like POTS. This clinically looks like dysautonomia. This clinically looks like cervical instability or craniocervical instability. And this can clinically look like a Chiari malformation. Before I got diagnosed, I literally was diagnosed with every single one of these things before my accurate diagnosis was made. So if you follow me on social media or you look back in like some of my older pictures, I did a trial of neck bracing. I was in a hard Aspen collar for 6 weeks. And I do have craniocervical instability, and I know that I've had it for a long time, but I've managed it really, really well with exercise and doing my physical therapy and using a brace during flares and that kind of stuff. So it didn't make sense to me when they were like, it's CCI, because I was like, I've had CCI, and CCI didn't give me this degree of disability / my CCI wouldn't just go from like, I'm functional and then I'm not functional throughout the day. Like that doesn't make sense that I would wake up fine in the morning and then, go to bed and feel like I just got run over by a train throughout the day. And the diagnosis of POTS and dysautonomia didn't make a ton of sense to me either, because I was like, why would I just suddenly develop POTS? Like, why would I suddenly develop dysautonomia? Like, this doesn't make sense. And I knew I didn't have a Chiari malformation because I didn't have just sagging of my brainstem and cerebellar tonsils, which is common in Chiari. Like my whole entire brain from the top down was sagging on imaging. So I was like, this isn't a Chiari. The really, really scary thing is that there are people in our CSF Leak group. There's a great group on Facebook. There's a group on inspire.com. that have been misdiagnosed with Chiari and had Chiari surgery, and it was a leak the whole time, which is horrifying because literally a Chiari malformation surgery is where they cut the back of your head and, you know, remove part of your brain and sew up your dura again. And the treatment for a CSF leak is an injection. So I actually have a friend who's very dear to me who had a Chiari surgery unnecessarily, and it was a leak the whole time, which is devastating, and it happens way too often. Like once is way too often, you know, but it happens more frequently than we'd like it to happen. So things that you should think CSF leak if you have this evidence of a connective tissue disorder, joint hypermobility and so forth. Here's like some of the more systemic findings with HSD and EDS. But if there's atypical neurologic findings with a headache, like gait disturbance, meaning you're kind of falling over, you're having trouble walking, you're having cognitive changes, you're having motor and sensory changes, meaning things are going numb, you know, you can't use your hands the way you did before, or, you know, people are complaining of things like, oh, I'm having trouble swallowing, or I'm having trouble, like, you know, my eyes are shaking, or my eyes are, you know, moving around, or, you know, I'm having trouble hearing. Those are considered atypical neurologic findings. Like, I don't care what kind of tension headache you have. A tension headache's not going to make you fall over when you walk. A tension headache's not going to make you have, you know, loss of your hearing, loss of your vision. For me, I actually lost vision at night for like a good year. Like, I just couldn't even drive anymore because I couldn't see in the dark. So there's a lot of things that can happen. And if, you know, if you're getting told as a patient frequently, hey, it's a tension headache, or hey, it's, you know, dementia, or hey, it's this, or excuse me, not dementia, it's a, you know, a migraine, or it's your period, please, you know, get a second opinion, get a third opinion, get a fourth opinion. For me, it was a 12th opinion that finally made the difference. So, excuse me, my phone just went off. It's the vet for my dad. But yeah, please, please, please keep advocating for yourself if you suspect this. So again, I put down here things that mimic this, or clinical mimics. If this goes undiagnosed, it can look like dementia. It can look like Parkinson's and other movement disorders. My grandmother actually, we now know, had a CSF leak from a bad epidural when she gave birth to my dad. So she lived for, you know, 50 years with a CSF leak. And she was diagnosed with Parkinson's and was on Parkinson's medicine for like 30 years. And we finally took her to a new doctor in the final years of her life. And they were like, she doesn't have Parkinson's. Like, why is she on Parkinson's medicine? And they were like, but she shakes and she tremors and she has movement disorders and her hands shake and she can't use her hands. And they were like, well, sorry, like, we don't know what it is, but it's certainly not dementia or Parkinson's. And so basically, she had a leak the whole time and it was undiagnosed. So, I can't imagine how many other people are out there with these symptoms or with these syndromes, that maybe have a leak and that can be helped and we can treat them. So that's a big part of what drives me to like continue to raise awareness of this. So again, some key points, is that headache might not be the first symptom, or it might not be really the most disabling symptom. So for me, when I finally was like so sick that I couldn't work anymore, if you would have asked me what my top 3 symptoms were, it would have been the fatigue, the brain fog, and the nausea. Headache would have been like number 5 or 6 on that list, because I was way more worried that like I couldn't swallow anymore or I couldn't think anymore. Like those were a lot more concerning for me than the headache. Also, my headache didn't come till the end of the day, so it wasn't really even present on my mind because I had already had half the day under my belt feeling like crap, you know, before I realized, oh yeah, I have a headache. And profound complications can occur, which is the big reason why we really need to treat this and recognize it. And most importantly, this is a curable condition. Like, I am back at work full time, and a year ago I was in my bed. A year ago, I had to retire from clinic because I couldn't be upright anymore and I couldn't think anymore. And it was really, really scary. My doctor had even signed paperwork to waive my student loans at one point because he was like, you're not ever going to be able to work again, Bri. Like, I'm really, really sorry. Like, I don't know what to tell you. Like, I'm just really sorry that this has happened to you. And I just was like, no, like, that's not the answer that I'm going to settle for, you know? So It's a curable condition. It's a treatable condition. And I just need to keep emphasizing that because people with this condition don't have to suffer the rest of their life. So what do we do when we want to work this up? We need to get brain imaging, number one. So most importantly is a brain MRI, ideally with and without contrast. We can actually see 80% of leaks on brain MRIs. So there's lots of different imaging findings. I'm going to go over them in a little bit of detail, not a ton, because I know a lot of EDSers are super duper smart and they have to really honestly resort to reading their own imaging because their doctors won't do it for them. So I'm going to show some examples, again, not medical advice, just educational information. If it's not seen on brain MRI, you can see it on spine MRI with or without a extra weighting type of thing called a myelogram. So you can do a CT myelogram or an MRI myelogram. There's two different ones. The MR myelogram does not require them to puncture your dura and stick dye in there. It's just done with the machine and the weighting of how they do it. But a CT myelogram does involve them sticking a needle in your back. So just be forewarned for those of you that are maybe going through a CSF leak workup at this time. But only about 50% of people will have their leak recognized or, have imaging found on their spine imaging. So brain MRI is definitely the preferred mechanism. And then lastly, to kind of confirm the leak, you can get what's called a lumbar puncture, where they actually go in and they take a sample of your spinal fluid and they measure the pressure when they enter your spinal fluid to see if it's high or low. So with brain imaging, the MRI should be done with and without contrast if possible. It's really, really important to note that if your brain MRI comes back normal, that does not mean that you don't have a leak. Again, that does not mean that there's not a leak if the brain MRI is normal. I had 4 brain MRIs that were normal, like with air quotes. The reason that it came back as normal is because the radiologist who reads the report or reads the film and then creates the report that your doctor then sees didn't know how to read for a spinal fluid leak or intracranial hypotension because they weren't taught that in school. So I'm on my brain MRI. It meets all of the clinical findings and all of the diagnostic criteria for leaks, but it was read as normal by at least 3 different radiologists. And it was literally up to me to read my own brain MRI in order to confirm, like, yes, I have a leak. This is what I have. And it's not, just random new onset pops, and it's certainly not anxiety of my period, So 20% of patients do have a normal MRI, but again, that doesn't rule out a leak. The longer you leak, the more your brain tries to compensate and the less pronounced your imaging findings are. So that's really important to know because if you're like, dang, I might have had a leak for 10 years, your brain MRI probably doesn't look super, super unusual compared to how it maybe looked at the onset of your leak. So it's really a variable grab bag. Dural enhancement, which is when that membrane lights up really bright on the imaging. The longer you leak, the less enhanced the dura becomes. So the less inflamed and the less bright it looks on imaging. So that's another thing that kind of obscures the ability to catch it on imaging. And then very often as the brain sags and those cerebellar tonsils or the base of our brain starts to drop, it can be mistaken as a Chiari malformation, and then it occasionally leads to an inappropriate surgery that, of course, won't be successful because the problem is not Chiari, the problem is the leak. All right. Are there any questions so far, Kendra, before I go into the...
No, I don't. I mean, there have been a few questions talking about just treatment, which I know you're going to get into. And
I'm going to get
I've made my own notes. So I was just trying to make sure that you get through your presentation because it's super helpful. And I'm just making my own notes and I know you're going to get into the treatment. So we'll just wait until.
Thank you. Okay, perfect. Yeah. And then stop me at any point if you have any questions. So appropriately, the mnemonic for the brain MRI findings is SEEPS. So SEEPS stands for subdural fluid collection, enhancement of the Pachy meninges, which just basically means the lining of your brain is very enhanced and bright. Engorgement of the venous structures, so kind of enlarged veins in our brain, so they look really prominent and they look really apparent. pituitary hyperemia, which the pituitary gland should be a certain size, and if it looks enlarged, then that's considered hyperemia, or it's kind of like swollen in appearance, and sagging of the brain. I had all of these for many years over many studies, but because again, the radiologist didn't know how to read for the MRI or for the intracranial hypotension on MRI, my brain MRI was read as normal. So then my doctor got a report that says Brianna's brain MRI is normal, and then wrote on my chart that my brain MRI was normal. So if I had left it up to them, I would just say, oh, my brain MRI was normal. And, you know, I have the privilege of being a medical provider. I have the privilege of knowing how to read a brain MRI. And I had to go in and teach myself advanced neuroradiology, but I have the privilege of being able to do that. So had I not continued to advocate for myself and read my own brain MRI, then I don't know where I would be right now. So this is a picture of a brain on MRI. The journal article is referenced down here. But if you can look at the top of the brain right here, especially, see how it's kind of like darker there? You can see fluid right here up at the top. And this brain just looks like, almost like it got dehydrated. You know, it just, there's not a lot of fluid up here at the top. The membranes on the outside right here, see how bright they are with all the arrows pointing at them? Normal meninges and normal dura is not this bright. Okay, so this is really, really bright dura. And that's that enhancement of the meninges. And really importantly here is if you look at this brain stem, right here in the front where these arrows are pointing, this brain stem is flat. A normal brain stem should be round. It should be like a round, like a half circle. So the fact that this is flat, this literally means that this poor person's brain stem is pushed up against the base of their skull to the point where it has literally flattened out. And when your brain stem flattens out, your brain stem doesn't function correctly. So it causes things like POTS and dysautonomia and swallow dysfunction and cranial nerve issues. And their pituitary down here, you can see, is kind of squished. So there's a lot of findings on this brain MRI. Other findings are these enhanced vessels and enhanced meninges. So you can see right here, this is actually fluid collection under here. These really bright membranes again. And then if you look at the ventricles right here, that's the little like triangle type, or the 3-point thing right here. These are the vessels through which spinal fluid flows. They're called the ventricles. The angle of the ventricles right here, like if you could draw a little V right there, should be less than 120 degrees. This is almost 180 degrees. So this V right here should be a more tight V instead of like a flattened out V like this one. And then right here, you can see this person's brainstem is really, really flat, right? So that's indicators of a spinal fluid leak. Also, the base of their skull is here. And if you draw that line, you can see that their cerebellar tonsils are herniating. So this person might have gotten misdiagnosed with Chiari malformation because their cerebellar tonsils are herniating if the person looking at their MRI didn't know, oh, the pons, the midbrain, all of the other findings on this brain suggest a leak, not Chiari. So there's another example of those bright findings. Sorry, I think that's a duplicate slide. And this is actually my brain MRI. So I'm sharing this with you guys. So you can see Brianna Cardenas way up in there. So I had a big fluid collection right here. You can see my brainstem wasn't tremendously flat, but my brainstem was flattening out. My pituitary was a little enlarged, and there's the base of my skull right there. So I did have some significant cerebellar tonsil herniation. So at one point, a neurosurgeon suggested that I had Chiari, and I was like, I really don't think so. Also, right here is the base of my skull, and you can see kind of how my cerebellum right here at the bottom is kind of peeking out over the edge. So my brain was literally herniating into my neck. Also, your brain, I don't know if this is common knowledge or not, but the brain should be round on cross section. You can see mine kind of makes like a little triangle appearance. Like one of my friends looked at this and was like, your brain looks like the roof of a house because it looks kind of triangular. So it shouldn't look like that. And you can see that my membranes here with the contrast weighted image are a little bit bright. Not as bright as that other ones, but they're bright. My ventricles right here, this angle was really starting to flatten out. And then my pituitary was really, really big. So at one point I was diagnosed with a pituitary tumor, and they did this whole like pituitary workup of like my hormones, and they did a super zoomed in MRI of my pituitary and stuff. And it was an intense and wild journey. Also, right here, this is a picture of the vessels. That bright white area in there was my enlarged vessel. And on certain other films, I didn't grab all of them, but my blood vessels were very enlarged in my brain on MRI. So that was another finding. Moving on to spinal imaging. So this is, kind of confusing because there's so many different types. So you can do the MRI without intrathecal contrast, which means without putting dye directly into the spine. So it's less invasive to do it this way. All you have to do is adjust the weighting on the machine. So if you have to get a myelogram, I would say it's certainly less invasive to do the MR myelogram, but leave that to, your healthcare team, not medical advice, just letting you know an MRI myelogram is much less invasive than a CT myelogram. Sometimes they do it with contrast. It goes in your vein, it doesn't go in your back, which is good. And then if they still don't find it there, then you may need to move on to a CT myelogram, which is a CT, unfortunately. The imaging protocol in 2017 was updated to say that they want to do one on each side. So they put dye in your spine and they put you on your side, and then they scan you. And then another day, usually it's like the next day, or if it depends if you live close to the facility or not, but then they'll put dye in your spine, have you lay on the other side, and then do that same procedure again. So it is a lot of invasive imaging, unfortunately. And then during that time, when they have to put the dye in your spine, they are puncturing that dura and essentially making another leak to do the imaging and to do the diagnostic workup. So while they go in there, if you ever have to have your dura punctured, ask them to measure the pressure. And then you're doing two procedures with one poke and kind of killing two birds with one stone, so to speak. This is what it looks like on the spinal fluid. So on this picture right here, it looks like the dura is just this nice like tube structure. But when it's anatomically, when you look at it, it's actually like it has sleeves on it. So you can have a poke in the back. My sleeves are where it's affected. So see how on this image right here, there's like kind of a outpouching like that. These are what I have, these perineural cysts, these meningeal cysts. And for me, those little sleeves started leaking. So I had at 1.5 areas on my spine. I had surgery on one of them because I had actually had veins growing to it. And so they needed to surgically remove the veins. But all the other leak sites that I have, because I still have 4 active leaks, but you can tell like my cognition has returned and I'm upright and I'm able to talk and walk and stuff, even with active CSF leaks, because the main one was addressed. And all of my procedures are done outpatient now. I don't need to go to the hospital once a month like I used to have to do. Easy findings for CSF leak on spine MRI. So again, that dura is that black membrane right here. All the spinal fluid is supposed to be inside of it. So if there's fluid on the outside of it, that means that fluid has escaped. So that means there's a leak. Here's a spinal cord here. And again, there's that black membrane, which is the dura, and there's spinal fluid on the outside of it. So CSF should stay in the dura. It should never go outside of the dura. And then here's my MRI. So this is what my myelogram looks like. This is the side of my leak. And you can see there was actually CSF trailing out of my back along the nerve root. But this was read as normal. So please don't get discouraged if your brain MRI comes back as normal and your spine MRI comes back as normal. Because it wasn't until they did the weighting of my images that they were like, oh, you have lots of these little cysts here. This is the one I had surgery on, and these are the ones that I still continued to get treatment for, and all the other little ones. So even if you have lots of these cysts, treatment is possible. Life after a leak is possible. So don't get too discouraged. There's hope. So treatment, moving on to that, there's a big range. So you can start with conservative treatment, meaning that you just rest in bed, which kind of sucks, to be honest. Like there are some times where I'm just flat and there's nothing else I can do but get flat. And it bums me out because I have to be flat. But for me, it's better than going to the hospital, So spending a day flat for me is super helpful. Hydrating and caffeine, if you can tolerate caffeine. Not everyone with POTS can handle caffeine. Not everyone with EDS can handle caffeine. But caffeine is one of the few things that actually makes more spinal fluid. So I am about that coffee life and about that caffeine life. I literally even have caffeine pills in my backpack in case I need it. So caffeine is like my best friend. And the other thing that I use on a daily basis is an abdominal binder. So because if you think of the spinal fluid of like a balloon full of fluid, and your body is another balloon that holds it, the tighter you squeeze the balloon, the more pressure goes up. So I use an abdominal binder daily to increase my spinal fluid pressure, especially when I start getting symptomatic again. Before I would get a blood patch and only get like a week of relief at a time. Now I get a blood patch and I go 6 weeks, and then kind of the last week I start to feel kind of yucky, and then I use a binder for those days. I actually have my blood patch tomorrow, and it'll be 6 weeks since my last blood patch, so definitely awesome. And then CAM stands for complementary and alternative medicine to kind of treat secondary symptoms. So I used a lot of CBD and like cannabis tinctures to help treat my nausea, which is considered an alternative medicine. I had tried literally every single anti-nausea, antiemetic that you could think of, to the point where I was going and getting shots in my butt every 3 days from my doctor. And he was like, you just need to consider trying cannabis because this is ridiculous. You're literally having to come to my office every 3 days to eat, and then you can only eat that one day, and then you're going 2 days not eating. And I was like, all right. So adding CBD into my regimen was tremendously helpful. And then the most common treatment is an epidural blood patch. So what this entails is an epidural procedure where they stick a needle into the epidural space, epi meaning outside of the dura. So in the epidural space, they inject blood basically to try and make a clot or a scab in the hole, hoping that the clot will basically seal the leak and allow your spinal fluid pressure to return to normal. For me, those are just amazing. Like, it was literally night and day difference when I had my first blood patch. Like, the next day I was like, oh my gosh, it's me again. Like, I can talk and I feel amazing and I can sit up and not have like a pounding headache. And it was really, really profound, amazing relief, like very promptly. Tomorrow will be my 12th blood patch. So I've had 12 patches over the course of a year. That's a lot longer treatment than most people require. A lot of people, even EDSers, get better with like 1, 2, even 3, 4 patches, but they get a lot better and stay what we call sealed for a really long time. And for me, because I have so many and my leak was so extensive, I have a little bit longer treatment road of recovery, but I have made what I consider a pretty profound recovery. So recovery is possible even with multiple leaks, even going undiagnosed for a long time. I use what's called PRP, platelet-rich plasma, and I am very privileged to have access to that kind of care because not everyone in the country does. But I've found a doctor that's willing to do this procedure with platelet-rich plasma, which is where they take your blood and they spin it down and they pull out just the platelets, which are the extra clotting and healing factors. And then they inject just that at my leak sites. And that has really, really helped me turn a corner as far as recovery has been. You can do an epidural patch with glue. So some people do fibrin glue. I tried fibrin glue and it worked amazingly well for me. It lasted for like 3 months. But it was a little more painful, and some people have mast cell reactions to glue, so that's kind of a downside. And some people do require surgery. So I've required all of these. I've had glue patches, blood patches, PRP patches, surgery, and every single one of them helped in their own way. So it just really depends the places in the country where you can go to get this treatment. If you live on the East Coast, the closest place to you is in North Carolina at Duke. If you live in California, or in like northern part of the United States, then you want to go to Stanford and see Dr. Ian Carroll. At Duke, you would see Dr. Tim Anreim or Dr. Linda Gray. And if you live in Southern California or in the Southwest area region, Dr. Wouter Schubink is who you want to see at Cedars-Sinai. This just goes into a little bit more depth on that epidural. So usually you direct it at the site of the leak if you know where the leak is at. Sometimes you can do a non-directed patch just now, even as a diagnostic measure, because some people say, I don't really want to have all that imaging where they stick needles in my spine, stick dye in my spine. Like, I'm good on that. No, thank you. So you can actually do a non-targeted blood patch to see if, hey, if we put extra pressure in there, does this person feel better? And it's considered a diagnostic and therapeutic procedure. If you respond well to a leak, to a patch, then you have a leak. It's really that simple. So if adding more pressure helps you feel better, then that means you have low pressure. To me, for people that are going through a diagnosis or they're hunting down their diagnosis and really having to advocate and they're not sure, do I have a leak? Do I have Chiari? Do I have CCI? What do I have? In my opinion, this is just my opinion as a person with EDS, not my like medical opinion as a healthcare provider, but in my opinion as a person with EDS, I would look at the treatment options. So the treatment option for CCI is fusing your neck. The treatment option for Chiari is brain surgery. The treatment option for a leak is an epidural injection. So to me, I was like, well, I'm going to start there because on the off chance that it is a leak, that's the least invasive and that's not an irreversible procedure. Having your neck fused is irreversible. Having your brain and back of your head cut open, that's an irreversible procedure. So to me, it just made sense as a patient to start with the least invasive measure and then move forward if I needed to. Surgical repairs can be difficult and they're not very technically straightforward, so don't go into surgery being like, I'm going to be cured after surgery. No, after surgery, I still needed 9 more patches. So surgery helped tremendously, but it by no means was a cure-all. And then because I have flimsy EDS dura, that tissue is harder to work with. So there's lots of different leaks, there's lots of different locations. I absolutely had to have surgery because I had veins that weren't going to resolve themselves without surgery. And then some people, if they've had all these things and they still are leaking and they're still symptomatic, those are rare people, but if that happens, some people have what's called dural reduction surgery, which is where they go in and tighten up your dura. That's a very extensive surgery. So I don't recommend that surgery lightly unless your surgeon tells you absolutely have no other options. And some people even put a catheter, like an epidural pain pump, but with just saline to press a button and put more saline to pump up that fluid as needed. So other key points, some people, an unknown amount of people, because there's not a ton of research on CSF leaks, but an unknown amount of people will just get better. So sometimes leaks just heal on their own, which is awesome, right? So that's called self-sealing. Some people just get a leak and they self-seal. Awesome, that's fantastic. And then very, very rarely we have some serious complications. So I don't want people to think that that's like the norm, like, oh my gosh, if I have a leak, I'm going to have a stroke or die of a, brain aneurysm tomorrow. Probably not. These are rare complications. And then epidural patches are super effective, but they don't last very long. So don't go into an epidural blood patch being like, I'm getting my patch tomorrow and this is the end of my CSF leak journey. Unfortunately, that may not be the case, but just go into it thinking, hey, I'm going to hopefully get relief from this patch and continue with my healing. And I'm grateful to know that, hey, even though I'm on patch number 12, for example, I'm grateful that I've continued to make a recovery and I may need patching for the rest of my life, but I have a life again, which is not something I could have said a year ago. Correct interpretation of brain and spinal imaging is vital, like literally the difference between whether or not you get your diagnosis. So keep fighting, especially if you're like, I don't know if I trust what that doctor told me or that radiologist told me. Keep fighting, go get a second opinion, right? And then many, many, many patients have favorable outcomes, like the majority of people heal and go on to live better quality of life. But there are still some people that suffer and are in bed still, and they're bed bound and they don't have access to treatment. So treatment access, it's not that we don't have the technology to do this, it's just that treatment access is a really big barrier for a lot of people because it costs a lot of money to fly across the country to get treatment if you live in like Illinois or if you live like in the middle of the country and all of these facilities are, 1,000 miles away from you. It costs a lot of money to come get treatment if you don't live in Southern California. Like I'm very privileged to live in California and I recognize that not everybody has that access. So I don't want to make it seem like I have EDS so anyone can, get cured. Like, no, I had to work my butt off in PT and I had to keep fighting and I had to go to 12 doctors and I am very fortunate that I have family that works and, can get treatment. So, and then let's see. As far as the prognosis, most people do well. Some people continue to have symptoms. Some people continue to have other comorbidities. So like I still don't have full feeling in my hands. They're coming back I still have like urinary retention, but it's getting better. And I still don't have full use of my leg or full sensation to my leg, but it's certainly a lot better. My cognition is about 80% of what it once was. So I don't feel like I've ever gotten as sharp as I used to be, but I'm grateful for 80% because I was running on like 10% before. And then the super important thing to remember with a CSF leak is it's not just a headache. It's literally a daily brain injury. And that's the part that I think a lot of neurologists even and specialists don't understand. Like literally if your brain is rubbing on the base of your skull, that is the brain injury. And a lot of people can subsequently have dementia as a result of repeated brain injury. That's what happens like with football players when they get that chronic traumatic encephalopathy. So if you have a daily low-grade brain injury, like that's not good for you, and that causes problems long-term. So that's why I'm focusing my research on this, because I don't think that everybody with dementia just suddenly developed dementia. I think that maybe there's a lot of people, especially women out there with Alzheimer's or dementia, that might have a CSF leak, and we don't know. But I definitely am looking forward to doing this research so that we can hopefully give those people a better quality of life. And resources that you can have and go to. If you want more info, please go to spinalcsfleak.org. It's an amazing, amazing foundation. Wear purple for Leak Week. So I'm in my purple sweater and I've got my zebra. So I'm repping EDS and Spinal CSF Leak at the same time, but it's Leak Week. This is where we like to raise awareness. We love donations. So the Spinal CSF Leak Foundation is super amazing and has some volunteers and amazing people that are working tirelessly to try and advance the understanding of this condition and just the awareness of this condition, both amongst patients and the medical community. And then there's a website called inspire.com, which is amazing because you can stay anonymous if you don't want to give your information out. And you can go forward with, finding the Spinal CSF Leak group on Inspire. And it's an amazing wealth of people who share their experiences. You can ask questions, a forum type website, but you can maintain your anonymity as a patient and really get a lot of great information. Also, there are just a lot of various resources. I see patients, like I said, with EDS, so I'm happy to see patients who want to come and get more information. And just lastly, last slide is I just wanted to go through and share, this was me literally a year and a half ago. I was in a neck brace. I couldn't walk. I couldn't remember my phone number. I couldn't speak in full sentences. And I have had multiple hospitalizations, 3 patches, then surgery, then more blood patches, 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 more blood patches. So I have number 12 tomorrow. But now I do with this targeted PRP, and that's made a huge difference, even though I have multiple leaks. And I've got them all the way at my neck, even though there's a challenge, this is something that I'll probably deal with for the rest of my life. But happiness is a choice I make. And a big part of what I think my healing has come down to is just the fact that I have access to treatment, and I just have amazing support, and I just decided I'm not going to let this beat me, So thanks so much for listening to my presentation.
Well, it was awesome. Thank you. If you want to just diminish your slides or just put your slides down once you're done so that people can see you more.
Sure thing.
Yeah.
Stop share. Is that better?
Yeah. So it's 1:00. So your presentation was so awesome. I have my own notes. There's a number of questions, but I want to make sure that we're cognizant of your time. Do you have time for Q&A? And
I certainly do. Yeah, okay. No, I can probably spare at least another 15 minutes.
Okay. All right, great. So I'm going to try to go through them as fast as possible. I have like I said, I have my own notes for questions. And then I'm just going to try to go through and just ask. I already mentioned that there was a question about treatment, which you already went through. So I'm just going to kind of go through. So first of all, thank you. So as and for people that don't know, so we started talking and we wanted to work together. But then in talking to Brianna, I was like, oh my gosh, do you know what I've been going through for the last 5 years? Right. And I was like, Brianna, this is my super secret side that I haven't really shared with anybody, but do you know, I lost my night vision and nobody knows what's going on. So needless to say, Brianna has been a huge propel factor in my own journey, in my own issues, to really take this more seriously and think, well, maybe that's why I was recommended to have an MRI several years ago and I didn't. So needless to say, I have to say that talking to Brianna and knowing that we were going to talk about this really has propelled a lot of my own journey. And I'm very honest when I share this stuff. Because I'm a patient too, and I deal with this daily, and I think so many of us are just so used to going around to doctor, and then you think, oh gosh, do I really want to go again? What's the treatment going to be like? Like, I don't have the money, I don't have the time. What's it really going to happen? Can it really help me?
Right, and for me, I was like, I don't know if I have the emotional resilience.
Right, the emotional capacity. I'm saying, I have the capacity to handle this. Just keep going the way that I need to go. And it's just really funny because the more that we talked, you have been really the one that I'm like, okay, all right, I really need to maybe this is why I was really, go figure, my doctors are pretty smart. This is why, they recommended that I do get the MRI, the MRA, the MRV, and really rule this out. But like you said, it's not always, I always viewed CSF leaks as this very big, headaches were very severe. And I have headaches every day. And so many of us have headaches. I have migraines. I have ocular migraines, which I just dealt with for 2 days. I have cluster headaches. And so much, when you have so much that you deal with on a daily basis, it's hard to know really what's going on. And is it more severe than others? And especially if it's not significant, it's just something that you deal with. And then the more we talked, I was like, yeah, I am really laying down quite a bit more and different things. So it's been quite interesting. So thank you for your presentation, but also thank you for, this has been a huge factor in my life. I don't know the answers yet, but we'll see. Okay, so questions that we have. Somebody says, if you feel, and we're going to keep these broad, not specific to somebody, because we have to, that's from a perspective of we can't talk about personal medical advice. This is not a webinar for personal medical advice. We can't give medical diagnosis. This is just for your information. I always try to make this disclaimer. So this is just informational only.
Don't sue me.
Right. As broad as possible and not necessarily personal, and just talk broad. It might not be your case or impacting your case or relative to your case. We're just going to try to keep it broad. Okay, so somebody says, if you feel pain in your neck and have headaches, does that mean the leak is high up, or could it be at any location in the spinal cord?
So it could be at any location. The reason that the pain is centered at the base of the head and kind of upper neck region is because that's where those pain sensitive structures like the dura and parts of the brainstem and the spinal nerves are getting compressed by the skull. So that's really the junction where everything starts to kind of tunnel into and pinch off in. And that's a lot of the reason that people are maybe it's CTI because it's up in your neck, or maybe it's a tension headache because it's at the back of your head, My leaks are from T10 to L1, and my pain was at the base of my head and top of my neck. So I would constantly say it feels like my head is too heavy and I just need to hold it up because it's just hurt.
Well, and that's what we're told a lot of times in CCI too. So everybody, there's been a lot of comments on the comorbidities and the overlaps of symptoms that I think so many people have. I mean, a lot of us have CCI. I really resonated with what you were talking about, the symptoms, exactly the same as you. I think I've had CCI probably my whole life, but is that really is that really what's causing my issues so significantly in the last couple of years? I was also negative on an MRI for Kiara. I would love to go back. I was looking at your MRIs. I was thinking, can we just really go back and look at mine? I'm like 6 to 7 years ago. But it's very interesting. So I think there's so many of us that have a lot of these symptoms and maybe even a lot of these pathologies, but really what is the cause of this significant symptom? So somebody asked specifically to that, if they have a normal brain MRI, is there somewhere they can send their images for a second opinion? If so, where?
So a couple places where you can currently send them. One is you can send them to Dr. Rita Shibink at Cedars-Sinai. So if you look up Cedars-Sinai, CSF leak, you'll find his info. I don't know how frequently he's doing that. I know he is just swamped with patients. I see patients now in California. So if you're out here, I'm happy to see you as a patient. I don't currently have the capacity to set up imaging review remotely, but that is something that I'd like to work on and get to the point where I can do that for patients. And then also a person, who I know is responsive to email, but is also very swamped with Dr. Carroll at Stanford. And you can send your info to the team at Duke as well.
Yeah, and that's just for a second opinion or just imaging review. That's kind of a second opinion. They're willing to do imaging review, kind of a second opinion.
That's my understanding.
Okay, so it's always best to ask them if they will do imaging review or second opinion if they haven't seen the patient.
That's correct. So you can send an email, absolutely, and some patients in our various groups have had success in that fashion.
Okay, so that's great. Okay, so then what if somebody has anaphylactic reactions to ingredients and medications?
Is that just like broadly medications, or is that?
I just would keep it broad and just say people maybe have mast cell issues and they are very sensitive to ingredients and medications. So in terms of, I would think this also leads to maybe what's in the ingredients for the patches and different things. You know, I don't know. Maybe that's
right.
What they didn't give any more specifics. I'm just thinking if they have anaphylactic reactions to medications, if we're talking about patches and things, they're concerned about what's in them.
So I would say broadly, people who have MCAS or chemical sensitivities don't do super well with the glue. They tend to have more mast cell reactions with glue patches. However, the blood patches are your own blood. So as long as you don't have significant autoimmunity, meaning immune reactions to your own blood products, blood patches are typically tolerated very well.
Okay. All right. Can spinal stenosis cause a leak?
Potentially. So if the stenosis is due to a disc herniation, so I can actually pull up like a really awesome image of that.
All right, so you're gonna pull up a really awesome image.
Yes. Let me close out my like resources here. Sorry for being like up in the camera.
So while you're pulling up the image for a spinal stenosis, can that cause a leak? Can an epidural cause a leak?
Yes, absolutely. An epidural is one of the main causes of spinal fluid leaks.
Okay. I'm just going to keep asking you questions while you're pulling that up for the sake of time and to make sure, because these are really good questions. Okay.
Here's a good picture. So
right. You have to share your slides. Yeah, just click to share your slides again.
Let's see, share screen. All right, can you see my
screen? Perfect. Okay.
All right, so spinal stenosis can occur as a result of disc herniation. And so in this person, this is a really severe one, but this person's disc is pushing in towards their spinal cord. So if you have a calcified bone spur, or if you have arthritic discs or bones that are pushing this way over time, and they're sharp, and you have EDS or you have a predisposition to flimsy dura, right? Like if these bone spurs are really sharp and jagged, like see how these ones down here are starting to get kind of pointy, or these bone spurs right in here are sharp. So if anything gets calcified and if it's harder than your dura and it's sharp, it can create a point that can essentially create a tear or a leak in the dura. So yes, absolutely, a calcified bone spur that causes stenosis could also cause a leak. Yeah.
That kind of looked like what I remember with my MRI. One of the issues on my MRI personally. My cervical spine. So right. Okay. Somebody said, or maybe it's a Chiari malformation comorbidity, like not vice versa. That makes sense. So maybe.
Right. So like maybe Chiari caused it.
Yeah.
Potentially it could. So basically our CSF is supposed to flow around our brain, down our cord, up our cord, down our brain, around our brain in a constant fluid flux, right? And if anything impedes that, whether it's that brainstem herniation from Chiari as the first cause, then stuff that's trying to get back up into the brain can't, and that creates a fluid backup. Typically, we don't see that cause a leak in the dura. We see what's called a syrinx formation, which is a pocket of fluid in the spinal cord. So to my understanding, Chiari is not a cause of leaks, but leaks can cause what looks like Chiari.
Okay. Going on to, I think I've handled all the questions and I'm going to try to rapid fire my own. Can it sometimes get worse? Can it get worse sometimes and give you high blood pressure and feel like your head is about to blow up? or spontaneously explode, as I sometimes said.
For me, it did. So remember that as you lose fluid, those blood vessels expand to try and compensate for that fluid loss. So for me, like if I would cough, if I would bend over, if I would sneeze, if I was sick, or if I had cried, like I was significant, like, like my head's gonna explode. Yeah. So I definitely had like significant pressure headaches. Like someone was literally like pushing on my eyes or like pulling.
Yes.
Yeah, it was very, very, very uncomfortable.
Well, and that's what's so hard about all of that is, I mean, how many different conditions can we all talk about that are kind of related to all of those things? Whether it's you feel like you're allergic to crying, or I've had one time where I literally was like freaking out because I felt like my eyeball was going to pop out of my brain, and I thought that I had like an aneurysm behind my eye. We rushed to the hospital, and my eye was totally bloodshot, and everything was okay, you know. But I mean, there's just so many different things that you think about that can happen or comorbid.
And anything can happen. So I mean, like for me, I saw a question come up about like hot, like wet burning and like the ears, the nose, the throat. And so for me, like I literally like, because your cranial nerves wrap your face like this, they wrap over the top of your head, they wrap around through your neck. For me, so my ears would burn. I had like this constant, like right under my eyes, like once I could feel like, hey, I'm leaking again. Like it literally felt like somebody had like sprinkled water on my face. Like if you ever gotten like spritzed by like a spray bottle, it felt like that, but it felt like prickly, like hot, like someone had sprayed hot water on me. And then I would constantly have this like drip, like down the back of like my ear, but not my throat, like the back behind my throat, but in front of my spine. Like it was really weird. And at one point I even had pain like that went through my like chest cavity. Like it felt like it went from my neck, like through my heart into my stomach. And it was really, really weird. But it was all vagus nerve stuff because my vagus nerve was getting.
Well, I mean, that's another whole thing that people have been talking about too, that we could probably talk about in a whole entire webinar in terms of like the vagus nerve and research and saying. That's another one we should talk about.
Totally.
We'll talk about that at a different one. We'll talk about vagus nerve and how it can relate to that, to be decided and talked about. I just want to make sure that we are cognizant of your time, and I have specific questions. So, and there's things I want to make sure that I talk about. So what about if you have an MRI that shows a whole lot of cerebrospinal fluid just like collect that doesn't drain?
Like at the top?
Yeah, like it just like, you know, you have an MRI and it has like all the cerebrospinal fluid, like, you know, the gap like this.
Yeah, so a subdural fluid collection is one of the SEEP's criteria. So that's collected on the top could be as a result of a couple of things. So it could be a leak where your cerebellar tonsils and everything has kind of like created an obstruction where stuff can't flow back out, which could be like a high pressure headache, so to speak. Or it could be from intracranial hypertension, which is high pressure, which is also another thing that happens with EDSers. So that's just one of the criteria is that subdural fluid collection, and that's why we look at other things like the brainstem and ventricle angle and that kind of stuff.
What about if you are sleeping, you feel better when you're laying down, but you wake up and you're just totally swollen and collecting like almost fluid all over your head? It's almost like it doesn't go anywhere.
So for me, it felt like that. And I think it's because it was a relative high pressure state because I was used to being in low pressure. So then when I would lay down, everything would come back up to the top and my brain was like a dehydrated sponge that was like suddenly rehydrated, you know? So I think it can be very variable depending on like how your symptoms are and how your brainstem and tonsils are laying in that neck joint, you know? So
what about stimulant medications? Would that help or improve? What if somebody finds that they, you know, have a lot of these symptoms, they're overlaps, they don't really know what's going on, but they find that stimulants have helped?
So I think that, you know, it could be a couple of things that can cause that. So some people with EDS are a little bit neurodivergent. So like I am not on the autistic spectrum, but I am certainly neurodivergent. And that's a common comorbidity with EDS.
We're all quite special.
Yes. So stimulants were like, you know, how I got through grad school. You know what I mean? Like I definitely had my Adderall prescription that was like, and I felt better on that just because it allowed me to focus more. But I think for some people, it helps them feel better because it clears their brain fog. For some people, it helps them feel better because it gives them like the inability to focus on their pain because they're focusing on their work. So I would just try to be cognizant of like, do I really feel better, or am I just like focusing less on, and do I just feel more functional?
Yeah, really, what is it that's helping? What is it really?
Right.
Helping?
Right.
All right. A few more questions as I could literally talk about this all day. Okay. Does fluid pour out of your nose and taste salty with metal with a leak? Like, does that happen? I know that
that happens with cranial leaks. Yes. So cranial leaks, that does happen. There are a couple of different cranial leak specialists. There's one in Colorado.
What's the difference between cranial and cerebral spinal fluid leaks? Some people might not know.
So the only difference with a cranial leak, it's still a leak of cerebral spinal fluid. So they're both CSF leaks. But a cranial leak is when it's in the dura of your head. And a spinal CSF leak is when it's down in your spine area. Okay. So it's the difference of location. So
what about leaking in the ear?
Some people can have leaking out of their ear as well. There are people in our Inspire group especially that have had a lot of experience with cranial leaks. One of our moderators in the Inspire group has had experience with both spinal and cranial leaks. And there are various different testing options that are available for that as well.
Yeah, I remember that one summer. It was probably like 3 summers ago where I had random fluid leak in one of my ears. And I remember thinking, this is really weird. And then it stopped. Yeah. And then all of a sudden I have this whooshing that's constant. Like I have my own white noise machine in my head.
Right. Yeah. I had a lot of whooshing, a lot of crackling.
Yes. The crackling.
I would turn my head and I'd be like, oh, I can hear again out of that ear. I didn't realize I couldn't hear out of that.
Yeah. You know, so this is why we're all doing this. And this is why I'm asking these questions. Okay. The last question is that I can see that because I know you have to go. Will this kind of issue, injury to the brain, if you will, condition, cause scarring on the brain? That's a good question. I mean, that's a very, very good question, and that's honestly what I hope to find out. So, I'm doing research, or that's within the next 3 years. That's my like time frame to do the research. But my research is going to be to determine what changes occur as a result. So we now have imaging that allows us to image for CTE, which is that chronic traumatic encephalopathy. Yeah.
And they can actually radioactively tag or trace the tau proteins and amyloid deposits. So the neurofibrillary plaques and tangles are what create Alzheimer's. Like we have too much deposition of this, protein that creates a scarring, if you will, or at least prevents our nerves from talking to each other well. That's also the mechanism of CTE. My hypothesis, at least, this has not been studied or founded at all, but my hypothesis is that anytime the brain is injured, that's the response, right? Because it's a chronic, like almost like scar tissue formation, but it's that increase of that deposit of those tau proteins. So now that we can image that, people that have had CSF leaks that know that they had CSF leaks, if they can get this type of imaging, then we can say, yes, it's tau proteins, or no, it's not. And then that can tell us, hey, is this the same mechanism as dementia? Is this the same mechanism as Alzheimer's? And then that would further support that CSF leaks are a cause of dementia or Alzheimer's.
And taking that one step further, just on another personal note, is that, I know that the last Q&A that we did with Dr. Dempsey on mast cell, we talked a lot about brain health and encephalitis, as you're correcting that.
Yeah, I had to put my TMJ back.
I would love to talk more about how this is related to encephalitis, and then also talking about amyloid protein. Amyloid protein in the body is called amyloidosis, which my mom is from. Which is important because not, how it affects the brain, we might be also missing how it impacts the body.
Totally.
The other thing that
can cause like kidney issues and everything.
Oh yeah, my mom passed away of cardiac amyloidosis. So the other thing is that I know some of us, and I've never even talked about this, I don't think much, or there's ever been any studies, is that some of us, when we've had our brain imaging, we've noted that we've had white lesions on our brain that are indicative of MS, and MS is comorbid to EDS, but we don't have MS. So my question is, how is this related to, lesions on the brain at all, or,
Right.
from what I understand, I know I have the white lesions. Nobody's ever followed up with it. I don't have MS that I know of, but there's just a lot that can happen in the brain. And as people have said, there's just a lot of this is really overlapping. And
Right.
how do we know?
We don't know yet. And that's like the crap part, you know, our science isn't there yet. And some people with MS can have worsening or improvement of their lesions depending on other factors like their diet or their stress level, you know. So until we know, hey, what's the mechanism behind that and what causes it, not necessarily to deposit, because we know the pathophys, like we know what causes MS, but we don't know, like, how do we explain when people have MS and then their lesions resolve? You know,
well, and it's a lot of inflammation
happening there.
Cell related, you know, I know that there's other factors.
Right. It totally can be.
In the brain, how do we know that it's not leading to other issues, especially if we have an underlying condition that is kind of predisposing us to. There's just so much more that we have yet to understand. So
yeah, inflammation is a huge driver of pathology, and one of the things that I have found that just helped me tremendously was lowering any sources of inflammation. So even though I thought it was hokey at first, I was like, literally, I'm bedbound. What does it hurt me to meditate? And I started, and that tremendously helped. I also got rid of dairy, gluten, soy, and sugar out of my diet, and that made a huge difference. Like,
that was also why you and I
more than I ever thought.
We have a lot of shared feelings on integrative health and complementary alternative medicine, because there is a lot of research and there is help. And at the end of the day, if you're bedridden, if you can learn to meditate for 5 minutes, how do you know that it's not going to help? And that acts directly on the autonomic nervous system. It acts directly on the autonomic nervous system. So, you know, there's research on music and how that helps the brain and different things. So at this point, not much we can lose. All right. So I think everybody's saying thank you. Some people are saying that they've gotten relief from Diamox.
And if Diamox helps.
Some people are saying that they feel worse when they lie down.
So those are kind of like the inverse symptoms. And so that is more indicative of a high pressure or intracranial hypertension.
Yeah.
Literally the inverse process of a leak. Too much fluid set in that enough.
Yeah. And maybe some of us go back and forth. So
possible. Yeah. Totally cycle.
Well, thank you. It is. I want to make sure that we are cognizant of your time. It's 1:27 to go, and I know you're working. So thank you so much for your time. This was awesome.
Thank you,
how many people are saying thank you? This was awesome.
Thank you for watching.
And any other questions, you guys can contact Brianna directly. Share the information, and I point you into the right direction. So thank you again.
Bye. Thank you.
Bye.